Hi, my name is Dr.
Gaukhar Baidildinova.
This video is a part of my lectures on evidence-based medicine and epidemiology. A case study or case report describes a patient with an unusual illness. Some well-known examples are Alzheimer's and Parkinson's diseases, named after the scientists who first described them. A case study usually focuses on one patient, but in some cases it can include more. For example, the Belarusian State Medical University allows up to 10 cases in a single study. Case reports are still important in medicine. For example, The Lancet, one of the top medical journals, published a report on Novichok nerve agent poisoning. Happily, a very rare event. On August 20, 2020, a 44-year-old man who was previously healthy suddenly became confused and began to sweat heavily on a domestic flight in Russia approximately 10 minutes after departure. He vomited, collapsed, and lost consciousness. This was the case of Alexei Navalny's poisoning. If you want to write a case report, follow the Equator Network guidelines. Use the CARE guidelines for clinical cases and the SUPER guidelines for surgical cases. I also have 2 paid courses on Udemy. The Critical Assessment of Clinical Studies teaches how to read and critically evaluate clinical studies. It's a very great course. The same as my second course, Scientific Writing, where I tell all the nuances of how to write a scientific article or dissertation. Links are in the description box. From case study, we are moving to case series. A case series is an observational study that looks at a group of patients with a similar condition. There is no strict minimum number of cases required for a case series, though some studies may include as few as 3 cases. Case series are commonly used to describe the clinical features of a disease. While many case reports and case series are anecdotal and have limited value, some can highlight previously unknown diseases and play a significant role in advancing medical science. For example, HIV/AIDS was first recognized in a case report of Kaposi's sarcoma in a young gay man, followed by a case series of men with pneumocystis carinii pneumonia. Another example of a case series could be the removal of assembly foam from the body. One patient attempted suicide by ingesting mounting foam, while 2 others inserted it into their anus. Advantages of case series. They can be the first to identify and describe new diseases. They help researchers study disease mechanisms and propose potential causes and treatments. Although case series can provide valuable insights, their results are usually considered preliminary, not final conclusions. Disadvantages. There is no comparison group, making it harder to draw firm conclusions. Cases may be studied at different times and stages of the disease, which can affect consistency.